Hello everyone, I am Dr. Shrihari Anikhindi, consultant gastroenterologist at Sir Gangaram Hospital in New Delhi. Today I'd be discussing about adenocarcinoma of the pancreas. So pancreas is basically an organ which is situated in the upper abdomen. It plays a very important role in the digestive process through the release of several digestive enzymes. It is also intricately involved in controlling the blood sugars of the body through release of hormones like insulin and glucagon. So cancer of the pancreas, which is also called as adenocarcinoma, occurs when there is an uncontrolled and excessive abnormal growth of the cells of the pancreas. This adenocarcinoma can have catastrophic complications to the body. Talking about prevalence of cancer of the pancreas, so pancreatic cancer is the 12th most common cancer in the world, 4th most common cause of cancer-related mortality in this world. In India, the rates might be slightly lower than the West, but the rates are gradually and progressively increasing over the last many years. So what are the risk factors for pancreatic cancer? So risk factor is something which increases your odds of getting a disease. There are several important risk factors for development of pancreatic cancer. The most important risk factor for pancreatic cancer is tobacco. So this tobacco might be in the form of smoking, or it might also be in the form of oral ingestion or chewing in the form of pan masala, which is significantly common in many parts of India. Obesity is a strong risk factor for development of pancreatic cancer. A condition called chronic pancreatitis, where there is a permanent inflammation of the pancreas, is also known to cause pancreatic cancer. There are certain genetic and hereditary syndromes where the genetics is transferred from the parents to the child, though these are very rare, but these are also known risk factors for pancreatic cancer. Exposure to certain petrochemicals on the long term are also known to cause pancreatic cancer. So what are the signs and symptoms of pancreatic cancer? Unfortunately, in the early stages of the disease, there are no signs and symptoms. The disease usually presents late, and the most common signs and symptoms are jaundice, which is a yellowish discoloration of the eyes and the urine, pain, which is usually in the upper part of the abdomen, constant, dull, and often radiates to the back. There is significant weight loss usually associated, and there is a progressive decline in the appetite in most of the patients. Mind you, recent onset diabetes is also a sign of pancreatic cancer, especially in the elderly people. So how do we evaluate for pancreatic cancer? Thankfully, right now we have excellent tests which are able to diagnose pancreatic cancer with accuracy in early stages of the disease as well. The commonly available tests for diagnosing pancreatic cancer include a CT scan of the abdomen, MRI of the abdomen, PET scan of the abdomen. Newer endoscopic modalities have come into the play, which have transformed the diagnosis of pancreatic cancer. One of the very important modalities is an endoscopic ultrasound, which is capable of diagnosing even very small pancreatic tumors. It also has an added advantage of ability to take biopsies in a painless manner. Newer technologies like spyglass endoscopy are likely to improvise our diagnostic capability of pancreas cancers in the near future. So awareness about pancreatic cancer is extremely important because this disease does not present in an early stage, and once the symptoms come up, it is already quite advanced. You should contact your physician for any further information about pancreatic cancer.